12 Signs of Low Thyroid Levels. Hello, friends. Welcome back to our channel. Today we'll talk about the hidden signs of low thyroid levels. Do you ever feel like you're tired, packing on pounds for no reason, or just not feeling like yourself? Well, watch till the end, because we're about to uncover 12 surprising symptoms that might be your body's way of waving a big thyroid flag. Whether you're dealing with thyroid issues or just curious about this tiny but mighty gland, this video is for you. So let's get started and demystify the world of hypothyroidism together. 1. Fatigue. Fatigue is often the most noticeable and debilitating symptom of low thyroid levels, also known as hypothyroidism. This isn't just ordinary tiredness that can be fixed with a good night's sleep. It's a persistent, overwhelming exhaustion that affects daily life. People with thyroid-related fatigue often feel drained, even after sleeping for long periods. They might struggle to get out of bed in the morning, finding it hard to start their day. Simple tasks that were once easy can become challenging and require much more effort. This fatigue can impact work performance, social relationships, and overall quality of life. The tiredness is linked to how thyroid hormones affect metabolism. When thyroid levels are low, the body's processes slow down, including energy production in cells. This leads to a feeling of sluggishness and reduced stamina. Many people describe it as feeling like they're constantly moving through molasses or carrying a heavy weight. Thyroid-related fatigue often worsens as the day progresses. Some might start their morning feeling relatively okay, but find their energy levels plummeting by the afternoon. This can make it difficult to complete daily tasks or engage in hobbies and activities they once enjoyed. Exercise, which normally boosts energy, can leave a person with hypothyroidism feeling completely depleted. Mental fatigue is also common. People might experience difficulty concentrating, forgetfulness, and a general mental fog. This cognitive sluggishness can affect decision-making and problem-solving abilities. Some individuals report feeling like their thoughts are moving in slow motion. However, while fatigue is a key sign of hypothyroidism, it's also a symptom of many other conditions. This is why proper medical diagnosis is crucial. Blood tests measuring thyroid hormone levels can help determine if the fatigue is indeed thyroid-related. If it is, treatment with thyroid hormone replacement therapy often leads to a significant improvement in energy levels, though it may take some time for full effects to be felt. 2. Weight gain. Unexplained weight gain is a common sign of low thyroid levels. When thyroid function slows, metabolism decreases, causing the body to burn fewer calories. This can lead to weight gain even without changes in diet or exercise habits. Many people with hypothyroidism find it difficult to lose weight despite their best efforts. The weight gain is often gradual and may be accompanied by bloating or puffiness, especially in the face and around the midsection. This is partly due to fluid retention, another effect of low thyroid function. The extra weight can be frustrating and may contribute to other health issues like joint pain or cardiovascular problems. While treating hypothyroidism can help normalize metabolism, weight loss may still require additional effort through diet and exercise. 3. Cold sensitivity. People with low thyroid levels often feel cold when others are comfortable. This increased sensitivity to cold is due to the thyroid's role in regulating body temperature. When thyroid hormone production is low, the body's heat production decreases. Individuals might need extra layers of clothing, even in mild weather. Cold hands and feet are particularly common, as the body prioritizes keeping vital organs warm. Some people describe feeling chilled to the bone or unable to get warm, no matter what they do. This sensitivity can affect daily life, making it uncomfortable to be in air-conditioned spaces or participate in outdoor activities in cooler weather. The constant feeling of coldness can be physically uncomfortable and mentally draining, impacting overall well-being and quality of life. 4. Dry skin. Low thyroid levels can lead to dry, rough, and itchy skin. This occurs because thyroid hormones play an important role in skin cell turnover and sebum production. When thyroid function is low, skin cell regeneration slows down, and the skin produces less oil. As a result, the skin becomes dry and flaky and may crack easily, especially on the heels, elbows, and palms. Some people experience a pale or yellowish tint to their skin. The dryness can be severe enough to cause itching and discomfort. Regular moisturizers may provide little relief. The skin might sometimes become thickened or scaly, particularly on the lower legs. If left untreated, this skin condition can lead to secondary issues like increased susceptibility to infections or eczema. 5. Hair loss. Hair loss is a distressing symptom of hypothyroidism that affects both men and women. Thyroid hormones are vital in hair follicle function and the hair growth cycle. When thyroid levels are low, hair follicles can go into a resting phase, leading to increased hair shedding and slower regrowth. This often results in diffuse hair loss, where hair thins all over the scalp rather than in specific patches. The hair that remains may become dry, brittle, and prone to breakage. Some people also notice thinning of their eyebrows, especially the outer third. The texture of the hair may change, becoming coarse or fine. While hair loss can be emotionally challenging, it's often reversible with proper thyroid treatment. 6. Constipation. Constipation is a common and uncomfortable symptom of low thyroid levels. Thyroid hormones help regulate digestive function, including the movement of food through the intestines. When thyroid levels are low, this process slows down, leading to infrequent bowel movements and hard, dry stools. People with hypothyroidism-related constipation may go several days without a bowel movement and experience straining or discomfort when trying to pass stool. This can lead to other issues like hemorrhoids or anal fissures. The slow digestion can also cause bloating, gas, and a feeling of fullness. Some individuals might experience alternating constipation and diarrhea. While increasing fiber and water intake can help, treating the underlying thyroid issue is often necessary for long-term relief. 7. Depression. Depression is a serious and often overlooked symptom of hypothyroidism. The link between thyroid function and mood is complex, but it's believed that low thyroid hormones can affect neurotransmitter levels in the brain. People with thyroid-related depression may experience persistent sadness, loss of interest in activities they once enjoyed, and feelings of hopelessness. They might also have difficulty concentrating, changes in sleep patterns, and decreased energy levels. Some individuals describe it as a heavy, foggy feeling that's hard to shake off. Depression can range from mild to severe, and may not respond well to standard antidepressant treatments if the underlying thyroid issue isn't addressed. Healthcare providers must consider thyroid function when evaluating patients for depression. 8. Muscle weakness. Muscle weakness is a common but often under-recognized symptom of low thyroid levels. Thyroid hormones play a crucial role in muscle function and metabolism. When levels are low, muscles may not function efficiently, leading to weakness and fatigue. People might struggle with everyday tasks like climbing stairs, lifting objects, or even holding their arms up for extended periods. The weakness can be generalized, affecting muscles throughout the body, or more pronounced in certain areas like the thighs or upper arms. Some individuals experience muscle cramps or stiffness, along with the weakness. This symptom can significantly impact a person's ability to exercise or perform physical work, potentially leading to decreased overall fitness and strength if left untreated. 9. Joint pain. Joint pain associated with hypothyroidism can be widespread and debilitating. The exact mechanism isn't fully understood, but it's thought to be related to fluid retention in the joints and possibly an inflammatory response. People often describe the pain as achy and stiff, particularly in the morning or after periods of inactivity. Common areas affected include the knees, hips, ankles, and small joints of the hands and feet. Some individuals may experience a condition called carpal tunnel syndrome, where the nerves in the wrist become compressed, causing pain and numbness. The joint pain can be mistaken for arthritis, leading to misdiagnosis. Unlike typical arthritis, however, Thyroid-related joint pain often improves with proper thyroid treatment. 10. Irregular or heavy menstrual periods. Women with hypothyroidism often experience changes in their menstrual cycles. Thyroid hormones interact with reproductive hormones, influencing the menstrual cycle. Low thyroid levels can lead to heavier or more frequent periods, sometimes lasting longer than usual. Some women may experience irregular cycles, with periods coming too close together or too far apart. In severe cases, periods may stop altogether, a condition known as amenorrhea. The heavy bleeding can lead to iron deficiency anemia, causing additional fatigue. These menstrual irregularities can affect fertility, making it harder to conceive. Women experiencing these symptoms need to have their thyroid function checked, especially if they're trying to become pregnant or experiencing unexplained fertility issues. 11. Slowed heart rate. A slowed heart rate, or bradycardia, is a less obvious but significant sign of hypothyroidism. Thyroid hormones help regulate heart function, and when levels are low, the heart rate can slow down. A normal resting heart rate is typically between 60 to 100 beats per minute, but people with hypothyroidism may have rates below 60. This can lead to feelings of fatigue, dizziness, or lightheadedness, especially when standing up quickly. Some people might experience shortness of breath or difficulty exercising due to the reduced heart rate. In severe cases, it can cause fainting spells. While a slower heart rate isn't always harmful, it's important to have it evaluated, especially if accompanied by other symptoms of hypothyroidism. 12. Impaired memory. Memory problems are a frustrating and often overlooked symptom of hypothyroidism. Thyroid hormones play a crucial role in brain function, including memory processes. When thyroid levels are low, many people experience short-term memory and concentration difficulties. They might forget recent events, misplace items frequently, or struggle to recall names or words. Some describe it as a mental fog or feeling like their thinking is slowed down. These cognitive issues can affect work performance, social interactions, and daily tasks. It's not uncommon for people to worry about dementia, especially if they're older. However, unlike dementia, thyroid-related memory problems often improve with proper treatment, though it may take some time to notice significant changes. And there you have it, friends. 12 signs that your thyroid might be trying to tell you something. Remember, knowledge is power when it comes to your health. If you found this video helpful, don't forget to hit that like button and subscribe to our channel for more eye-opening health content. Do you have questions or experiences to share? Drop them in the comments below. I love hearing from you. And hey, why not spread the wellness? Share this video with someone who might benefit from this information. Until next time, listen to your body and stay thyroid aware.